Once you have a behavior patient in the room, sometimes it's difficult to know if you should prescribe or not. And when I talk about prescribing, I'm also talking about recommending supplements. So you're going to ask yourself several questions. First, we're going to think about the recovery time. Okay, so the recovery time means how quickly does the patient go back to baseline. Now, we're not measuring internally whether or not the patient has gone back to baseline. We are basing this on what you can see and what the pet parent reports. If the patient has a super short recovery, then this patient may not need a medication at all. So the first question you are going to ask yourself is the quality of life of this patient affected? Because if the quality of life of the patient is affected, you should be thinking about prescribing something, maybe a supplement, but probably a medication. You're going to come to that conclusion based on asking the pet parent, right? And also making a judgment call yourself, because you and the pet parent won't always agree. You might look at the cat who is relegated to the outdoors because he urinates outside the box and say, oh, he's not going to live as long. This cat cannot be an outdoor cat. Whereas the pet parent might be thinking, oh, that's great. He gets to hunt birds and lizards all day. Doesn't he have a great life? So you're going to ask the pet parent, and you're also going to think about it yourself and marry those two answers. If the pet has a compromised quality of life, please consider a medication or supplement. Number two is going to be recovery time and latency to arousal. The latency to arousal is the time it takes for you or the pet parent to notice a gross change in the animal's behavior. This might be panting, pacing, crying, whining, just averting the gaze, or licking the lips, tucking the tail, right? All of those signs means that a stress response has already been mounted. If your patient has a super short latency to arousal, it takes a nanosecond, and he is blowing up, you probably need a medication or a supplement to help this patient. If there's quite a long latency to arousal, there's a lot of time between stimulus presentation and blow up, you might be able to distract the pet in those situations and do without a medication or a supplement. The other part of that is recovery time. When does the patient return back to baseline? As it stands right now, we do not have any good tests that you can perform and in an instant know if the patient is back to baseline. So you're back to observing changes in the body language, changes in body temperature, respiratory rate, heart rate, things like that. So if the patient has quite a long recovery, so think about when you put an animal under anesthesia, you want a quick recovery, right? So if a patient has quite a long recovery, that means they probably need a medication or supplement. If they have a really quick recovery, they may not need a medication or supplement. Another thing that you always want to ask yourself and ask the pet parent when it's a behavior case and you're considering prescribing is whether or not the patient is at risk. Is the patient at risk of harming themselves? Okay? Are they at risk of harming someone in the family or someone outside the family? Are they at risk of euthanasia, relinquishment, rehoming? If any of those answers are yes, please consider a medication or a supplement to help your patient. If an animal is at risk of injury to itself or injuring others or being relinquished or rehomed, you've got to step in with that magic bullet and make sure that you're giving the pet every chance to succeed. Consider other behavioral comorbidities. So you may have a patient that's got a mild stress, let's say a very mild separation fear, and the pet parent can work around it with their schedule. Maybe that patient doesn't need a medication. But if that same patient has a noise fear, and we're headed into thunderstorm season, and also has fear aggression at the veterinarian's office, now you've got these behavioral comorbidities. You're thinking now about prescribing. So if you can make a list of problems that are distinct or a list of diagnoses, please consider a medication or a supplement for your patient. I want you to also consider if the environment is not ideal for a positive outcome. Now, this does not involve judging people. Don't do that. Just ask people outright whether or not they can be adherent to the treatment plan. For example, even if the medication you're selecting is 3 times a day and they can only give the medication 1 time a day, that's a no-go. All right? So let's just say that they have kids in the house. We know from several studies, at least relating to aggression, that the presence of little ones in the house is going to be consistent with a worse outcome when compared to families that don't have little ones. Interestingly, in a study that looked at interdog aggression in the same household, so two dogs that lived together fighting with each other, the presence of teenagers in the house was associated with a poorer outcome than those households that didn't have teenagers. Now, I live with a teenager, so I totally get how that could be the case. So what you want to do is you want to give people this information so that they're well informed, and ask them what they can do. And if they say, I just can't do any of these things, I've got 5 kids under the age of 10, please give that pet parent a medication for their pet or a supplement to help speed their recovery from these behavioral problems. If the patient is mildly affected, you might be able to get away with no medication. But if the patient is moderate or severely affected, then you're probably going to be looking at a supplement or a medication. I do not have a validated scale that I can hand off to you that you can use to make sure that your mild, moderate, and severe are just perfect. What I ask that you do is just be consistent every single time, and also take into account what the pet parent is saying to you. If she's saying it's severe, even if you judge it to be mild, then it's severe, okay? Because she's in charge of whether or not this pet is going to live his life in her home for the rest of his life or not. So if your patient is moderately or severely affected, consider a supplement or a medication as part of an entire treatment plan.